Welcome back to Primetime News.
And a special welcome once again to our viewers on onespotmedia.com.
Up first this evening, for a second day, Jamaica has not recorded any new case of the coronavirus.
In a release a short while ago, the Health Ministry said the number of confirmed cases of COVID-19 in Jamaica remains at 63.
Only 2 results are pending from the National Influenza Center.
In the meantime, graphic details from a Jamaican living in New York City about how COVID-19 has changed her life.
Now, the woman is now home in isolation. As Anthony Lugg reports, she describes her experience as harrowing.
New York has been hit hard by COVID-19. Confirmed cases have reached over 150,000, more than 6,000 deaths, while over 9,000 persons have recovered. Nadine Burrell, a mother of 3, is among those recovering. She's originally from Almontown in Kingston, but now resides in New York.
This are the worst. The worst. You know, when you take a deep breath and you feel your body go in and out, that no happen. Your lungs are cement.
The situation in New York has worsened daily. Hospitals have set up makeshift morgues outside of their facilities to handle the pileup of bodies from the pandemic. Refrigerated trucks are also parked outside several of the largest medical centers throughout the 5 boroughs in New York City. As she fought back the tears, Miss Burrell described how she got to the hospital. When the ambulance arrived,
Upon the ground, me there, can't get the strength to stand up, peep up myself, everything in a one.
getting to the hospital would have given anyone hope, as you would expect to be given treatment. Unfortunately, she would have to wait. She says her vitals were taken, however, there were no rooms.
The nurse them just a run past you. When me cough and wet up myself, me I try call them and me I say help. Just a minute. By the time them hear you, them gone can appear running, nobody now walk. You hear me? Oh God.
If that was not already a task, imagine waiting up to 5 hours before a nurse arrives. Well, according to Miss Burrell, that was her reality. The nurse brought a patient beside her. After a few minutes, the patient died. Moments after, that patient was replaced with another who also died.
When me see everybody are dead beside me, and I couldn't breathe, I have to scream out for Jesus. And I have to say, 1,000 shall fall at thy side, and 10,000 at thy right hand, but it shall not come nigh thee. And I have to scream out for Jesus.
When she felt like hope was gone, she says it was faith along with prayers sent by her mother through WhatsApp that kept her going. But the next thing she heard from health officials shook her even more.
2 tools them come and said them a discharge me. Jesus Christ. Mr. Jesus, oh them discharge you to hospital. Eh? And you can't even breathe. The doctor come and say, there's nothing he can do for help me.
Her son came to the hospital wearing masks and gloves, and since then, she has been home in isolation.
This is no one easy thing, and I want to tell you some feel a little better. I'm still sick. So, we just have to pray. I just feel like me I get better. But when me see in the hospital, I don't know when me I go recover and get over that. Traumatizing, me I tell you.
The government of Jamaica has been calling for citizens here in Jamaica to play their part in assisting to flatten the curve. It's feared that if the numbers increase rapidly, the health system will be overburdened and cause serious challenges for healthcare workers. Anthony Lugg, TVJ News.